In about 2 minutes, welcome first of all. In about 2 minutes, we'll start the Fossil Free California webinar on green recovery and climate health now. We're glad you're joining us. We're taking a few more minutes here before 4:30 to tend to a few housekeeping details. So please stay with us and we'll join you shortly. Thank you.
So, can someone tell me if you're still hearing the background noise? Okay.
It's not too bad. The beeping has stopped. It just sounds like occasional traffic.
Okay, well, I don't think this is working anyway. All right, thank you.
Can you guys hear me now? This is Ashley McClure.
Hi, Ashley.
Hi. Good. Okay, so I'm speaking through the phone. It's having trouble starting the video for some reason. It's always something. Isn't it? Let's see. So I wonder, it'd be great if you guys, if I could share my face, but I'm also wondering, I could see if I can share my video, my screen.
Well, let's get your video first, and then we'll work on sharing your screen.
And in the meantime, I'd like to welcome everyone to Fossil Free California's webinar on the green recovery and climate health now. We're still tending to a few technical details so that our main speaker can be able to show you the slides that she'd like to show you today. My name is Martha Turner. I'm a board member of Fossil Free California. If you'd all just hang with us for one more minute or so, we aim to have that ability for our host, our primary speaker, to show her slides in just a moment. So please stay with us. You'll be able to see here our webinar and the agenda for that today. So just take a look at that, and then we aim to get started within just a few moments. Thank you.
There. Now you guys can see me. Do you usually wait a few minutes?
Yes, we do, Ashley. Yes, we're in that process right now. And do you now have control for your slides when you're ready?
I believe so. Yeah.
Do you see a share? Can you do a share down at the bottom?
Yeah.
You want to go ahead and test it?
Sure. Testing. Share.
Yeah.
Okay, great. So let me get up the, here we go, present.
Okay.
From the beginning.
Great.
Wonderful. Great. So I will host people in then. My name is Martha Turner, and thank you very much for joining today's webinar with Fossil Free California. And if we could, Vanessa, have our introductory slide up on the screen so we can bring people into the webinar today.
Bear with me. There's not enough real estate on my desktop.
So many of us are living into that reality these days.
Oh
yes.
my goodness.
I want a stadium screen.
Yeah.
Okay.
So thank you everybody for joining us. We have 36 participants, which is fabulous. So glad you could join us. My name is Martha Turner. We're beginning today's webinar on the green recovery and climate health now. And also we're having a special feature, which you can see here, what an Earth Week it is and was. So thank you very much for joining. I will go through a few details about the webinar, and then we will dive right into our various features today. We will be taking a look at our activities, some activities that happened during Earth Week. And joining us will be Clara Vondrich, and she will be discussing very briefly the Coalition for Climate Safe Pensions. And I should mention that that will be a very short segment so that we can dive into that more deeply at a future webinar. So please take a look at or join us for that part of this webinar, and then we will be going into that coalition work in a deeper way in the future. I should mention that Fossil Free California works at the intersection of climate policy and the finance sectors, both public and private. We grew out of the divestment movement, as some of you are very familiar with. I'm seeing some familiar faces on the gallery view there. And we continue to engage in divestment activities specifically focused on CalSTRS, the State Teachers Retirement System, and CalPERS, the Public Employee Retirement System. We also have other campaigns, and you're welcome to find out more about those on the Fossil Free California website, which is fossilfreeca.org. I would like to also just very quickly go through the webinar. We will be celebrating a few things about Earth Week. We have a very brief reflection I wanted to share with you. And somebody may have just
Wow. Let me unmute you, Martha. Sorry about that, everybody. Hang on, Martha. Let me pull you back up.
Sorry about that, folks. Obviously, we did get Zoom bombed. We thought we
By the
had
Russians.
we thought we had a secure channel, and apparently that was not the case. So we will let the technical person who has provided this Zoom link know that there is an issue with her Zoom link. So we may have to be doing a little bit more muting than we wanted to, and we do apologize for that in order to not have that occur again.
Can I interrupt here for a moment?
Please do.
Yeah, sorry about that, everybody. And since I'm not able somebody out there is trying to inject some Russian military music into our webinar. If you would like to say something, what I encourage you to do is in the chat. Well, depending on your Zoom account, you may have the ability to raise your hand, or to just put, if you don't, just put a star in the chat, and then Martha or I will call on you. Sorry, Martha, go ahead.
Yeah, thank you. Thank you, Vanessa. Vanessa, by the way, for those who have not met Vanessa, is the Executive Director of Fossil Free California. So, and was very diligently last week working on Earth Day activities, which we'll hear a little bit more about. I'm just going through very quickly our webinar for today. After we have the opportunity to talk with Clara Vondrich about the Coalition for Climate Safe Pensions, we'll have just a very brief reflection by Deborah Sylvie. We hope that this is a moment to take a breath, because this is a time of note in all of our lives. And then we have our feature with Dr. Ashley McClure. Dr. McClure is with Kaiser Permanente and also one of the founders of the Climate Health Now Alliance of Healthcare Providers. And we will have an opportunity to do breakout discussions. I think that'll be very informative, and a few report backs. We'd like to conclude this evening with the video that was of the panel that ran on Earth Day Live on April 23rd, a 16-minute short video going a little bit more into the climate safe pensions and also into the exciting work that's been happening linking youth and elders and together. So please do stay with us if you'd like for that video, and that will conclude the webinar for this evening. I'd like to do just a quick few little logistic things, and those include that your Zoom, you can use the chat function. When it has messages in it, it is orange colored. It can also appear on your screen as a white bubble, and that is at the bottom center of your screen if you're not as familiar with that chat function. So please feel free to use that, and please feel free to introduce yourselves at any time in that chat function. So that is a matter for the logistics for using Zoom. And also, I would like to take a moment to mention that we are living in a time of concern, even more than typically with COVID. Some of us, we're living in a variety of circumstances. Some of us have been personally, as has my family, been very touched by COVID-19. Others of us are living in other types of circumstances, maybe experiencing a variety of conditions regarding income or the health of loved ones, or possibly even one's own health. And we wanted to acknowledge that. I will be putting in the chat in a short while here a wonderful, helpful segment that Science Friday, if some of you are familiar with that, on public radio, ran on climate and adjusting in these times. So for those of us who are involved in climate change, how we can effectively respond given the nature of the moment that we're living in. So I will put that link in the chat in just a few moments. So now I think we'll turn this over to the Art Party video first, and then we'll introduce Clara and have a few short minutes with Clara. Thank you. And if you'll just stay tuned, we're just loading that video now.
Yeah, art party. And I'm going to start sharing my screen and give you a little overview of what we are about to do. I can't believe how much art you all made in an hour.
Oh, thank you so much, Vanessa, for having a little art party with us and showing us the incredible work that everyone did just before Earth Week to send the message that money needs to get out of fossil fuels now. So we're going to turn very briefly for a short period of time to the Coalition for Climate Safe Pensions. Clara Vondrich from Washington, D.C. is joining us in her time this evening. Thank you, Clara, for joining us this evening. And I'd like to briefly bring on Sandy Emerson, I believe, will be in discussion for about 10 minutes with Clara to just introduce the topic of the coalition. And we will go into that, as I mentioned during the introduction. We will go into another webinar and other opportunities to learn in much more depth than we can go into this evening about the coalition. So Sandy, I think we're ready for you and Clara. And I think Vanessa will be able to unmute Sandy and Clara.
Oops. Yes, Sandy.
Yay,
Okay.
here.
All right. And then let me get Clara. Sorry, everybody. The Zoom bomber really had me
Let's
locked
off a little.
down.
We're
Yeah.
getting on our game again.
Okay. Clara, are you there?
I am. Hello.
Yay!
I was amazed at the amount of content that emerged all over the United States and some from Canada for the Coalition for Climate Safe Pensions. It was an amazing outpouring of creativity. I'm so proud for Fossil Free California to be part of this coalition, which has been moving along, you know, for several years. Divestment campaigns just keep moving along. And Clara, you've been involved with divestment for quite a while now. I wonder if you could say just a couple words about your history and then what you hope for from the new coalition.
Sure thing. Hi, everyone. My name is Clara Vondrich, and I have spent the past almost decade working on divestment issues, first in my capacity as the climate account director at Fenton Communications, where one of my first clients was Divest Invest, which I subsequently became the director of and was the director of for the past 5 years. In my role at Divest Invest, I helped organize foundations around the world to not only get out of fossil fuels, but invest in climate solutions. And today there are over 200 foundations worldwide that have made that commitment. I also got to work with a lot of other sectors, being a volunteer on the New York State and New York City pension divestment campaigns. And also have been working over the years with Fossil Free California and the other efforts to divest pension funds around the country. So today there are over 12 state pension divestment campaigns in the US and a lot more happening in Canada. And we've been sort of loosely coordinating these efforts over the years, but I recognized there was a need to bring it under one umbrella and really have a dedicated staff person working on coordinating this work so we could get out, you know, hard-hitting narratives where we speak with one voice, where we address the fiduciary duty concerns that trustees have with sophisticated analysis and, you know, hard-hitting research. And also, you know, the need to start talking about joint strategies. You know, some of these pension trustees have their heels dug so far in, and it's becoming harder and harder to see a path forward. But in brainstorming with members of the coalition, especially coalition co-leads Fossil Free California, you know, we decided that one of the most obvious ways forward is to organize pensioners themselves. And we know that unions, some unions have been resistant to divestment for various reasons, but it's my operating belief that many of those sort of disinformation campaigns can be undone and that we can actually activate pensioners once they get the information in their hands that they are losing money. Their hard-won pension nest eggs are on fire because of climate change. And if we don't pull those investments out of a dying industry, they're just going to lose more. And not to mention, especially early, you know, folks that are just getting into a particular union job whose pensions won't come due for several decades. I mean, they're really being discriminated against by old guard investment policies that keep fossil fuels. So I'm just really thrilled that there's excitement around building a coalition on this right now. It couldn't be more important with the fossil fuel industry tanking even further than it has. We've known it's been underperforming and volatile for a decade, but the COVID crisis has just really highlighted the cracks in the foundation. And we also know that one of the last reasons why institutional investors like pensions are holding on is because they get this healthy dividend from the oil and gas companies. They pay out 6 to 7% every year, and pensions rely on that cash. But we know now, because of great analysis from our peers at IEFA, which is the Institute for Energy Economics and Financial Analysis, that that dividend is on the chopping block. We know that the companies have been borrowing money and selling off assets just to keep this dividend going, and it's unsustainable. So I really feel like we're at a turning point as far as the financial case goes. And we're also at a turning point because for the first time, or at least, you know, we're in the early days of this, so it's really exciting. Youth and elders are uniting behind this push. And to have the energy of young people whose futures are on the line, joining together with teachers and retirees and other campaigners behind this joint effort couldn't be more exciting. So the work that we did last week during Earth Day really highlighted the power of that new unity between young people and their adult friends.
Thanks very much. It certainly was an exciting week. And I wanted to mention that our ED, Vanessa Warheit, put on her other hat as major media producer and helped Clara put together a 16-minute segment that aired nationally during the live stream last Thursday, and an hour-long panel that aired locally on several live streams later that evening. So Vanessa, how was that for you?
Exhausting. But I've mostly recovered, and it was actually thrilling. I mean, it was everything that Clara just said is true. And I hope everybody on this call will stick around, because we have the 16-minute segment that's going to show at the end after all the other amazing content that Martha's pulled together for this evening. But if you can stick around to watch that, it'll really give you a sense of just like what's going on in Minnesota and New York and, you know, like Alaska, and just like, and we literally couldn't fit in all of the campaigns that are out there. Like those were just the ones that we happened on a, 48-hour turnaround. They just happened to have some video they could throw our way. But there's really a ton of stuff going on all over North America, which is super exciting. So yeah, it was, I didn't realize until after it was done how exhausting it was, because it was so exciting. And then once I was done, I was like, oh my God, I need to sleep for 3 days. So yeah, and thank you, Clara, for joining us tonight. It's always a pleasure.
It's a pleasure.
Thanks very much. And we look forward to doing a longer segment on the Coalition for Climate Safe Pensions in one of our upcoming webinars later this year. Martha?
Thanks a lot, Sandy. And Clara, really appreciate you joining us from the East Coast tonight. Thank you so much. So this is where we're going to segue over to green recovery and climate health now. We'd like to take a moment for reflection. And so I'm going to turn to one of our other board members and one of our original co-founders of Fossil Free California, Deborah Silvey. And I believe that Vanessa will be able to help Deborah have voice here, so to speak. And so once we have Deborah unmuted, she can, oh, by the way, yes, thank you so much, Vanessa. Here's where you can find out a little bit more information about the Climate Safe Pensions effort and the sister effort I'm very California-centric, I apologize, in Canada. So thank you very much for posting that, Vanessa. So if we could unmute Deborah, it looks like, Deborah, we have you ready to go.
Well, our coming together for Earth Week was not what we'd been preparing for before the COVID crisis. It was much more difficult in many ways, but it did force us to create new opportunities for working together for the climate crisis. I'm going to read a passage from Rebecca Solnit's book, A Paradise Built in Hell. She refers here to her own experience of the 1989 earthquake in San Francisco. The sense of immersion in the moment and solidarity with others caused by the rupture in everyday life, an emotion graver than happiness, but deeply positive. We don't even have a language for this emotion, in which the wonderful comes wrapped in the terrible, joy in sorrow, courage in fear. We cannot welcome disaster, but we can value the responses, both practical and psychological. Disasters provide an extraordinary window into social desire and possibility. And now, I believe we're ready for Dr. Ashley McClure.
Yes, so thank you, Dr. McClure. We're going to bring you off of mute and turn this over to you. First of all, thank you so much. I can imagine that it's a busy time for you. So we will go ahead and bring up Dr. McClure's slides, I believe, at this point. And for those of you joining us maybe a little late, we will have a presentation with Dr. McClure on the green recovery from the healthcare provider's perspective. And then we'll have about 10 minutes for questions. So if you have a question, would you please type it into the chat? That's a box down at the bottom of the middle part of your screen. Casey Loosbrock will be moderating that chat box and then grouping the questions together for Ashley McClure. I hope it's okay if I call you Ashley.
Yeah, absolutely. Yes, of course.
And so Casey will be grouping those questions together, and then Casey will pose them for us to Ashley. And so we'll have about 10 minutes of Q&A before we move into breakout groups. So thank you. Take it away.
Yeah. I have so much admiration for the leaders on this call, and I'm really very honored to be a part of this conversation. So thank you for the opportunity, and that piece that you just read definitely brings up a lot of the emotion that I have been feeling lately too. So right there with you. So this is a new space for me to be speaking. I'm really comfortable speaking in front of other health professionals, and this is all, as many of us, I'm really we're all kind of synthesizing what this means for our work in real time. So this is the first go at this content. So please keep that in mind, and I'm very open to feedback too, but I'll give it a shot. So the way that I have been framing kind of the opportunity out of this crisis is really trying to connect the health impacts of climate change with what is easily something that we all kind of can universally share, which is about health in general, but especially our children's health, because many people, even that I've been talking to lately, who are concerned about their elderly parents that they live with or their children, it's really people seem to care more about the health of their loved ones even than themselves. And I think I'll talk more about why we're highlighting that this is about our children's health and kind of what the green stimulus proposals and the opportunity of the COVID recovery, what it can mean for the future. So I'll incorporate a little bit of art in here, and this is from 350's website. So if you like any of it, let me know, I can share. So the funny thing is I can't go forward on my, there we go, okay. So I am here not as part of Kaiser Permanente. I should also articulate that very carefully. I am here as a co-founder of the coalition that you mentioned, Martha, called Climate Health Now, and this is our website. So we are California-based, but we're maybe starting to kind of grow even beyond California, and we're really health professionals who are advocating, who are activating our colleagues to advocate for climate solutions as upstream solutions to protect health. And it's been a very, very meaningful part of my life to have a community who has the shared concern for the future. And this picture is a example of our group. Most of this is medical students, actually. And this was in front of Speaker Pelosi's office on global climate strike last September, where we set up our urgent climate care clinic. And we actually had a very busy day that for the climate strike. We had a meeting with Speaker Pelosi's office, Senator Feinstein and Harris, and Barbara Lee's office, and we were really trying to help them, along with everybody, frame climate as a health crisis that it is, because we want to try to leverage what we can kind of share as a shared universal value, being health, and help our leaders frame it as such in order to kind of get beyond the political gridlock. So that's some of what we do, is meeting with elected officials. And actually today we were speaking to Senator Feinstein's office about the kind of opportunity of the response packages for investing in climate as well. So I'm not going to go into the details, but just to suffice, there's an inordinate amount of evidence about the health impacts of climate change. And this is, there's so many that it's really easy for it to kind of make our eyes glaze over. This image is from Dr. Patz in the CDC. But the main message is really that climate change is a health risk multiplier. So it has, myriad complications, and it manifests differently in different places and differently for different people. Here in California, we're most acutely sensitive to the extreme heat and the air pollution and the power shutoffs related to wildfire risk. So I'm not going to go into the details, but the key point is that it's a health risk multiplier, and that's why we're trying to activate the health voice, the health sector's voice, to really engage. And one of our dear leaders, Dr. Linda Rudolph, who's here in the Bay Area, she was a key kind of the broker, you could say, of this U.S. call to action on climate, health, and equity, which is a 10-point policy action agenda that was created last year through a coalition of health leaders, and it's now been co-signed by over 130 leading medical organizations in the U.S., including the AMA, the American Public Health Association, California Medical Association, and many others. And the first piece, I won't go into the details, but the first piece is we have to transition off of fossil fuels now in order to safeguard health. And that really they focus a lot on that the climate solutions we need are immediately going to benefit our health, and they're centralizing our actions around equity and protecting the most vulnerable among us. Frontline communities has to be central in our solutions. So it's there's like a one-page version and a longer version, but this is really what much of the health sector has already organized around, and it's all about basically divestment and transitioning to a zero carbon economy. And this is just a little poster that I saw the other day on a walk in Berkeley, the Just Recovery poster, which I like a lot, which I'll talk more about. So like I said, the kind of the framing for the health voice on the need for climate action is really that not only will it protect the future, but it will immediately make our air cleaner as we transition to a zero carbon economy. And kind of, even the more we get people into public transit instead of in their cars, actually that there's evidence for active transit lowering our risk for things like diabetes and heart disease and obesity. So these are all immediate co-benefits, which, as we all know, humans are much better at immediate threats and immediate benefits. So that's a really important frame, is to say that not only is this going to help tomorrow, but it will make us healthier and our communities healthier today. So the good old lever. In the health community, we really see our lever being our trusted voice. So if you poll Americans, actually most people are on mute, but just a rhetorical question. So what do you think the most trusted voice is in America in terms of professions? It's nurses. And a close second is doctors, and a third is pharmacists. And so we really have kind of the market cornered on trust in terms of professional advice. And so that's really what we're trying to bring to the climate movement is leveraging that trust into the kind of climate narrative to make it not about politics, but about our health. And that, kind of we see health as a shared value that really can help to bridge the divide. And so that's really the frame and the anchor that we're wanting to reshift the narrative to through our organizing. And there's just a representation that's all about teams and coalitions and, going between not just the health community, but reaching out to communities like is on this call, which are amazing, inspiring leaders, and really helping to make that 99% coalition unstoppable by getting out of our individual sectors so that we have a unified voice. So bringing it more to policy, the previous director of the World Health Organization stated this, which is that the Paris Agreement is potentially the strongest health agreement of this century, which I couldn't agree with more. And so that's really what we're trying to kind of articulate is that, I say this a lot, is that if we don't address climate, nothing that we do inside our clinics or hospitals is going to matter. So we're really trying to kind of shift to the upstream treatment, which we've all thought a lot about in terms of COVID and the flattening the curve, which I'll talk more about. But this is kind of the frame, this quote of the Paris Agreement, protecting our health, is really how we are seeing the opportunity for the COVID recovery packages. And importantly, if we can hit the Paris Agreement targets, that will save about 1 million lives a year by 2050 just from air pollution, not even all those other colored health consequences that I talked about. And the return on investment is, everybody would jump on this, is that the value of the health gains from climate action to achieve the Paris goals would be the benefit is twice the cost of the upfront mitigation policies, which we really see those upfront mitigation policies as what could come out of the recovery packages for COVID and should. So one question that Martha brought up and Sandy is, how do we keep talking in a tactful, relevant way about climate change when people are worried about dying from an acute crisis? How do we keep that kind of a conversation that people want to keep engaged on when there's this kind of fire in our face right now? And I really like, there's a tool through Eco America, which is a guide to communicating about climate change. And so I was trying to think a lot about that through how do we speak about it in a relevant way in general, and then how do we do it now with this acute crisis? And it's pretty simple stuff, and I'm actually going to try to show it, not just talk about it. But the first one is making it relevant for people. So whatever people are concerned about, connecting it to their individual concerns, into their community's concerns, and then connecting on common values, which I'll be very redundant on that being health and protecting who and what we love, and then making it personal and real and emphasizing solutions. And so that I'm going to try to kind of flesh those all out through the rest of this talk. So if you poll Americans and ask what the most important issue is for their voting, this is what you get. And this is from like a year and a half ago, but healthcare is actually the top, which is I think really important information, and then the economy and jobs. And unfortunately, we all wish climate was at the top of this, but it's not. But it's all related, and that's our job, is to show how. So, so I think, if we're starting with people, and now more than ever, I think the economy and jobs, as well as healthcare, they're probably even more important than when this poll was done. But the point is well taken, that this is what people are worried about. And So I'm going to see if this video plays, but this video helps to connect those and is kind of the whole opportunity of the COVID crisis is how to connect healthcare, the economy, and jobs to COVID and climate in a really seamless way. So let's see if this works. Oh no, it didn't work. Watch later. Maybe. Okay. Hopefully the volume works.
Ashley,
Yeah.
you are going to probably need to unplug your, start it over and unplug your headphones.
Unplug my. The thing is.
And play it out of the speaker on your computer.
But I did the headphones is on the phone. I didn't think about that. Maybe, would it be okay if I share this link in the chat and then somebody else plays it? Okay, let's do this. I'm gonna do exit. Okay. It's worth it. It's pretty good.
Yeah, it looks really good. I want to watch it.
Let's try. Okay, so here we go. I can't find my chat box.
Down
Clara
at the bottom?
wants to say something. You would think so.
Sorry, Clara wanted to say something?
And we're happy to post this link. We will post it in multiple avenues through Fossil Free California on our Facebook page and on our webpage, I'm sure. So if we're not able to post it right now, I know we can do that.
All right, here we go. I will play it for you. Stand.
Okay, cool.
We've all heard about the importance of flattening the COVID curve, and it's taught us one big lesson. Only collective action on a massive scale can avert disaster.
Good.
The science has shown us we not only have to act big, we need to act fast. Do you know what other curve needs to be flattened? The climate curve. The folks at climateclock.world have created a clear, easy-to-use interactive learning tool that allows you to explore why the big, important lesson we are learning from COVID is the same one we need to learn to address climate change. The information presented in these tools is based on IPCC data and has been developed in partnership with climate science experts. To protect our health, our home, and our planet, we can and must flatten the climate curve. You can use it at flattentheclimatecurve.org. You can even download it to your desktop or phone. These teaching tools are free. Please share them with scientists, teachers, and students learning at home. Let's save everything we love. Let's flatten the climate curve.
Nice.
Yeah, I like how simple it is, and I think everybody is resonating with the curve right now. We have this incredible attention for the flattening the curve, and so connecting it in this visual way is really opportunity. So I'm going to keep talking about how to bridge that connection, and this other kind of piece that's coming out of COVID is this. I've never heard anybody say we're all in this together as often as I have in the past 5 or 6 weeks. And I think the opportunity is expanding the we to not be a individualistic, fear-based we, but a more inclusive, collective we. And I think there's this window of opportunity. But I think what we need to do to really make that happen is to include the concerns of everybody in order to make that we real. So starting and staying with people, many people are concerned about their own health. And one way that I was kind of brainstorming about how to make COVID climate, the connection about personal health is through air pollution, and how the science is actually showing that, this is out of Harvard, that people who live in areas with chronically higher particle air pollution, particulate matter, so being exposed to higher levels of air pollution chronically makes you at higher risk of dying from COVID. So inversely, as we transition to clean energy, we'll all lower our risk of dying from COVID as we make our air cleaner. And this couldn't be more relevant here in California, where 6 of the top 10 worst air quality cities in the country are actually here in California. So that's one way, in a very personal health relevant way. And this kind of just shows that burning fossil fuels makes us sick not only through the health risk multiplier kind of pathway, which is the slower version, but the more immediate version is this particle pollution way, which increases our risk for heart attacks, strokes, dying from COVID, et cetera.
Hey, Ashley, you're not sharing your screen right now because you stopped. So if you've got slides that you're referring to, you might need to share again.
Okay, thank you. Let me do that. It was a great visual, so let me show you.
I had a feeling you might have something to show us.
So did you guys see this? We're in this together, is what I was talking about. And then the important thing is this visual that just shows kind of the two pathways. That
we don't see anything. You have to hit share screen.
How about that?
There we go. Great.
Okay, we're back in business.
Back in business.
Back in business. So let's see. Yeah, this. There we go. So again, connecting to the what are people concerned about right now, and how do we bridge that to COVID and climate? So rising unemployment, obviously, in a developing recession. So I was just imagining, people kind of responding that we can't worry about divestment, we can't worry about climate right now, we need to worry about getting food on our table and jobs. And there's actually this really interesting, there's research showing, there's too much text on here, so I'll just tell you, but people are concerned about kind of just day-to-day survival. And the research shows that the return on investment for money that's invested in renewable energies gives us more jobs than money invested in fossil fuel jobs. And there's all the health benefits and actually lower electricity costs. So I think packaging it in terms of, we're going to promote more job creation that can't be kind of exported to other countries through renewable energy is maybe a way that we can kind of start to frame the concern for employment and recession to climate and the need for a just transition. And then this one could make me cry if I really held the reality of it, is many people, of course, are talking about our elders and how we need to kind of collectively act to protect the health of older people right now, because COVID had been, does seem to be affecting older people more. And in contrast, climate change definitely is borne out mostly by children. So this is through the World Health Organization, that 88% of the burden of disease attributable to climate change lands on kids under 5. And that's right now. That's not even affecting, that's not even the future. So of course, future generations and the youth now will be bearing that brunt for years to come. But even right now, they're carrying the weight of it, which again, I think is really motivating. And that's my motivation, is my little 2-year-old, which I think this really lands in the pit of most people's stomach, because it's just so wrong, and is such a motivating force for most people. So our group, Climate Health Now, our campaigns, I think like many people, our campaigns are in flux. And right now what we're trying to get behind is kind of amplifying the things like the green stimulus proposal, which I'd be happy to share with many people. It's kind of like the Green New Deal repackaged as a stimulus response, and kind of promoting that as a health investment, which it would be. And our other campaign, which is in flux, but is kind of getting firmed up, is a health professional-led divestment campaign. Clearly, the time is not now for demanding that hospitals divest because they're trying to not go out of business. So that'll be phase 2. But health insurance companies are doing fine, so we might focus on them first, and really kind of leveraging the health voice that it is totally a conflict of interest for insurance companies to be investing in coal, which then makes people have more asthma, heart attacks, and then to be charging them for insurance for the same thing. So that's kind of where we're headed once the timing is right. And this is a question. So Clara, the work that Divest Invest has done is really, I admire it a lot. And on that website, what percent of the divestment pledges do you all think might be right now coming from healthcare? You would think it would be pretty high, right? Because morally, in terms of our mission, it should be really high. But it's only 1%. So there's this huge opportunity to align healthcare institutions and health insurance companies' mission with their investments. And then kind of the divest frame was amazing before COVID, but now the opportunity seems to be shifting towards the green stimulus and what that can do. So the green stimulus proposal is kind of a menu of solutions for public funds that starts at $2 trillion. They started with the first package, and they would automatically renew in 4% of GDP until the economy is fully decarbonized and unemployment rate is below 3.5%. And I really like how that's their, they kind of pegged the ongoing investments to when we actually achieve our necessary goals. And it's a very long document, but the description is that they were planting a left flag in terms of the stimulus response. And it's not an organizing tool. It is being circulated in DC and congressional offices, but to me, it really represents kind of the revisioning the Green New Deal into something that is very, very relevant right now with all these funds that are moving. So we're trying to promote it and frame it as a health investment that it would be. And it's aligned with what is an organizing tool, which is the 5 principles for a just COVID relief recovery package. And the kind of brand for the promotion of that is called the People's Bailout, which there's well over 300 organizations like Greenpeace and Sierra Club and many, many others, no health organizations. So that is an organizing kind of campaign that we're also trying to promote. And all this is in, both of these kind of tools are framed towards getting us to achieve the Paris Climate Agreements. So to close, so Martha asked if maybe I could share 1 or 2 easy steps to promote the green stimulus proposal and a just recovery for those of us here on the call. So the first one is tomorrow morning, actually, from 9 to 10, our coalition Climate Health Now is having a webinar, and we have really exciting lineup of Dr. Linda Rudolph, who's kind of one of the public health experts in the country, and then one of the co-authors of the Green Stimulus proposal, a professor from Occidental, and she'll be on the call, Mijin Cha, and then somebody from the People's Bailout, Molly Morabito, tomorrow. So if anybody wants to join that, I can share the Google form to register. And then the other piece is to call our elected representatives, federal representatives now, and then also to sign a petition, which this is a hyperlink that I can share, to kind of share with them what the just principles are, and to kind of give more support and vocalize the need for a green stimulus. And this is some opportunity through the People's Bailout. Also, they have some calls that you could kind of participate in. So that is most of the content, and I am really grateful to be here. Hope this is the beginning of an ongoing relationship to collaborate. And I would love for anybody to be in touch if you'd like. We do have a nascent YouTube channel if anybody's interested, and I'd love to be in touch.
Well, thank you very much, Ashley. Really appreciate it. I'm going to turn this over to Casey, who will summarize some of the questions, and we'll have about 10 minutes with questions, and then we will have our breakout groups. We may have them just a little bit shorter so that there's time for everything today, but this has just been fabulous. So Casey, can you help us with the Q&A that's been showing up in the chat?
Yeah, we had someone ask if Kaiser Permanente or other such bodies are gathering data related to respiratory illness and areas impacted by episodic and chronic pollution levels to kind of watch how people are affected by COVID and other crises we could see coming forward, and if you know anything about that.
So overlaying chronic air pollution and COVID illness, is that right?
Yes.
Yes, not in the integrated way you would hope if our public health system was as funded as it deserves to be. That would be easier. Actually, here in California, we're doing better than most. Today, Sonia Angel, who's the lead of the California Department of Public Health, actually posted an article about the inequities in who's getting sick from COVID and how the rates of people getting sick in African American and Latino populations, the people getting sick are overrepresented compared to their percent of the general population. So the answer is yes, public health kind of research is happening, but we already definitely in New York City and also across the whole country are seeing that people who are kind of vulnerable and disadvantaged socioeconomically are already getting sicker from COVID for lots of reasons.
Yeah, another question was hoping you could kind of discuss the comparison and effectiveness between COVID and the climate crisis. Is we are having mandatory actions to address the crisis rather than voluntary. Do you think we should take some lessons from COVID crisis in order to treat the climate crisis? And if so, what would those lessons be?
Absolutely. I mean, my friend has told me that in France, people are getting tickets if they're, out on if they're not kind of cooperating with the demands from public health. So I think this, absolutely, we should be learning from this. And I think what it tells us is that collective problems need collective solutions. And, if we had a government that didn't prioritize profit over everything else, and we could kind of collectively act for the common good. I mean, this is the role of government, right? That's absent right now because corporate kind of neoliberal capitalism is the king of the day. So yes, this is the role that government should be doing, and that I think the UN and IPCC is trying to do. But for instance, the government right now, I think, should be putting strings on all bailout money to demand reductions of carbon emissions over the next 10 years in alignment with the Paris climate agreements. We should be using government power to guide and support and subsidize our transition to renewable energy. So I think really that's the missing role of government that as I see it.
Awesome. Thank you for answering that so thoughtfully. Our next question is, do you think the argument that climate change and coronavirus could collide would be useful? For example, if we get bad wildfires this summer and fall while corona is still circulating and trying to evacuate in a flood during corona, do you think, these crises are going to affect each other when we inevitably hit those times of natural disasters caused by climate change and COVID issues?
Yeah, and I wish I didn't see that as inevitable. I mean, we are going to have bad wildfires because of climate change, and they are going to be extremely hard to respond to. And Dr. Mahoney, who's one of the Climate Health Now leaders on here, has articulated this well, that how are we going to do evacuations in areas where there's wildfires under the social distancing? Like, nobody knows the answer to that, you know. And this is the problem of climate change, is it's a health risk multiplier, right? So we're going to have more and more crises the more slowly we respond to climate change, and it's going to get harder and harder the longer we wait. So absolutely, wildfires pose a chilling challenge to how we're going to deal with it, because COVID's not going away. In the absence of a vaccine, normal is not going to return for, I would say, at least a year until we have a vaccine that everybody can get. It's very hard to understand how we will be in a different situation when the wildfires hit.
Yeah, and then our next question is, do you see any signs of hope for GOP support for green recovery, given their reluctance to even support failing states suffering from COVID-19?
That's a hard question. Signs of hope. I mean, I think Florida is a place where climate change feels less theoretical because of things like algal blooms and sea level rise. And so I think, you know, the federal leadership out of Florida, kind of the places where it's hitting more immediately is where I actually have hope. And I actually saw today a letter co-signed by 2,000 farmers kind of calling for addressing climate change because they're seeing it impacting their work and what they can grow successfully. So I think it's all about the constituency, us organizing, kind of saying that it's affecting us. And unfortunately, the longer we wait, the more broad the constituency that is being affected. But the only thing I could see affecting the GOP's kind of platform is their voters demanding that they do open their eyes.
I'm glad you mentioned organizing, because our next question is about just that. And it's, you know, medical professionals right now, and I'm sure you know, are under so much stress. How is organizing in that medical space during this crisis, especially with Climate Health Now?
Yes, it's strained, you could say, but I think we also see the opportunity. You know, I think we see that collective action for a common threat is possible. We see that change is possible. We see that crisis makes what had seemed impossible all of a sudden not so far off. You know, the fact that the economy has come to a stop because of a common threat. None of us would have believed that 4 months ago, and I think we see this opportunity to connect it, and we have the attention of the public in a way that is so hard to get. So I think although there is fatigue, there is this real clear sense of the opportunity to seize for the common good. So exhaustion, but also really motivation, because we see the possibility.
Beautiful answer. Thank you so much. I think we have 2 questions left, and the first one is, has the CDC concluded that global warming is a human health risk? And if they have, what's their action plan? If they have not, why don't they see that this is a health crisis?
Yeah, I mean, there's a lot of really good research about the health harms of climate change out of the CDC, and also it's called the Global Climate Change, so the body that puts together the National Climate Assessment, which is like the most truthful thing that comes out of the federal government, and it's a very comprehensive document that has a whole chapter about the human health harms of climate change, and then also a whole other chapter about air pollution, in addition to, chapters about like labor and agriculture. So that's federal. There are scientists who continue to tell the truth. And in terms of what the CDC's plans are, I can speak somewhat to, through the public health leaders of the CDC have created a framework for kind of addressing climate change called the BRACE program, which is all about adaptive management and helping to adapt our public health system to climate changes. And it's not about mitigation, but it is there. It doesn't get as much funding as it should, but there's definitely climate health research being done at the CDC and through the Global Climate Research kind of program that puts out the National Climate Assessment.
Thank you. And so we have blown past the Paris Agreement goals already, and our commitments aren't close to being met. So given that, how can we scale our asks to fit the scientific reality between, posing the Paris Climate Agreement as a Paris Health Agreement?
So how to acknowledge going beyond it and how to repackage kind of organizing for it. Is that right?
Yes, please.
I don't feel like I'm more qualified than anyone else on this call to answer that. I don't know. I think it's still a useful guide, and I appreciate the reality that it is not as relevant as we wish it was, but I think if we could half our emissions in the next 9.5 years, that still seems like the right North Star, as best as I can tell.
Thank you so much. Thank you so much, Ashley. Everybody, if you see at the bottom of your Zoom page something that says reactions, if you could all just press the clapping hands emoji to thank Ashley for her time today. We're so thankful.
Yay! Thank you. I appreciate the work you do, and I definitely hope to collaborate in an ongoing way. So thank you for having me.
For sure. Thank you so much for sharing that. And I saw that you posted a link. Is that your slide deck? Is that what the link is?
Yeah, please use them. Yeah.
Thank you.
If they're helpful. Yeah.
Great. Yeah. Thank you so much. And just to let everybody on the call know that this is all being recorded and we will post it on our site as well. If you want to share this with other folks who weren't able to join us today.
Great. So thank you, Ashley. For those who are interested, we are going to break into breakout groups. Casey's going to guide us into that. I do want to say thank you so much to Ashley McClure and also to Climate Health Now as a group. It's wonderful, remarkable work. And there's some wonderful colleagues in Canada who are also working on this. So good hearts everywhere. Casey, can you go ahead and start us on to the breakout groups, and then we'll reconvene in about 12 minutes, I think, total.
Yeah, so if Vanessa could just put up the slide for me. We're going to be breaking out into breakout rooms of about 5 people each, and we will be discussing. I'm going to drop it in chat while Vanessa is getting the presentation up. And it is, first, when you get into groups, please introduce yourself with your name, pronouns, affiliation, or organization if you choose, where you're calling in from, and what interested you about this event. And, we really encourage to take turns listening as each person completes these sentences with about a word or two. And we want to share today I'm most concerned about, and today I'm most hopeful about, in that order, please, because we do want to build a hopeful community here online. And the discussion questions about the presentation are going to be, was there anything in the presentations or in your life generally that suggests actions you might want to take, because of climate and COVID and our collective realities? And what exactly do you find hopeful about a green recovery? So our friend Vanessa is going to be breaking out into breakout rooms. You'll be able to view those questions in the chat. And yeah, take it away, Vanessa.
Okay. Go.
And then if you could hit join breakout room.
It feels so powerful. I've never been able to do this before and see everybody go off to their rooms. Right. So it looks like Erin, Jean, and Leanne, do you guys need help? There they all go. Leanne, do you need help? Leanne, are you still there? Hi, Christine.
Are you done now?
Am I done? No.
I just left because I didn't go into the thing and I was waiting for you. Are you going to start again after?
Yeah, we are. I just sent everyone a 1-minute warning.
Okay.
And in a minute, then I will close the rooms and then they'll have a minute to filter back in. How are
Okay.
you?
I'm all right. How are you?
Hanging in there.
You know what I was going to ask you? You didn't get a test when you were ill.
Correct.
Are you going to ever get an antibody test?
If I can get one. I've been asking for one for weeks.
Okay.
I mean, I could, my chiropractor actually told me that I could get one. There's like through some lab now that she knows about that like a private lab, but it's like $200.
Yo, mama.
And it's not CDC approved yet.
No, they're FDA approved, but it's
Or
not
FDA,
approved.
yeah, FDA. It's not FDA approved. And it's like $200. And now like there's all this stuff that shows that even if you've had it, you could maybe still get it again. So
I think the data's out. You can't say yay or nay.
right.
You know, it's and that makes it really, you have to assume you're not immune if you don't know for
Exactly.
sure that you are.
So on the one hand, it would sort of like, you know, placate my curiosity, but it's not really worth
Exactly.
$200. So
A whole bunch of people are coming back in.
here they come. Yeah, so I'm waiting for Kaiser to have one for free and then,
Right.
but you know, I think my cat got it. That's what really makes me think I had it.
And they're saying that's not impossible.
I know, like, well, first the big cats had it and then there was a report that like little kitty cats had it. And because I was completely strictly quarantined from my family except for the cat. Because I thought, oh, well, it's not a cross species. Like, I don't know. I remember thinking about it, but I remember thinking, oh, well, she's not human. I doubt she can get it. And then a week later, she was just sick. I mean, she was off her food and just kind of dragging around. And we were like, oh, and I'm like, Jesus, really? Do I have to take the cat to the vet under these like lockdown circumstances? Anyway.
But she got better.
Yeah, we both did.
All right, we're now gathering back. So I think there'll be other people joining in. And Casey, do you want to just take a few reflections at this point from the breakout groups? Oh, we need to unmute.
Yeah, if anyone wants to share something that was insightful or interesting from their breakout session, just put a little asterisk in the chat and we can call on you.
Really? Oh,
Anyone want to talk about what y'all, any sort of like the gestalt in our room was? If it's all right, if not, we can move on.
We really appreciated the intergenerational component of this whole work that we're doing across the generations.
Nice.
Yeah, Joni, did you want to say something?
Hi there. For me, I don't know if this was the gestalt of our room, but that sense that the leadership of the healthcare sector seems to be awakening in this COVID virus around making the connection between health issues and climate issues, and how important that feels to me personally, but I think to a lot of folks. Just hearing Ashley's wise and informed knowledge of the connection was really inspiring to me.
Are there any other folks who want to chime in? Sorry, Casey, you're kind of handling this.
I just want to second what Joni was saying. I was in her room as well. David, unmute yourself and let us know what you're wanting to say.
Yeah, so in our group, we were hopeful that the Green New Deal could, or those types of programs could get a foothold in going forward. Healthcare for all particularly, and those types of things. And then, you know, we don't want to go back to normal. normal wasn't working for a lot of people, whether it was healthcare or climate or these other things, the opportunities to get back to better than normal. And my fear was my local government wants to get back to normal as soon as possible. And I'm thinking they're missing an opportunity. And then we went from there to realizing that this next election says it all. If we can turn the White House and the Senate over, then we really have a chance to make some change. And if we don't, then we're really have a very difficult time making change. So not to forget the importance of the upcoming election.
I think we have time, Casey, don't we, for maybe one more reflection?
Yeah, if
before we
anyone
go to-
else would like to reflect, please put a star in the chat or just unmute.
Sarah Thies had her hand raised.
Well, we had various hopeful things or things people were hopeful about, but one thing that was comment that was made that I've been kind of in my own mind going, oh, Zoom, 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 too much Zoom, and I hear from everybody too much Zoom. But the point was made that Zoom is allowing her group, which is sort of a smaller rural group, to connect with people all across the state, and then Sandy was saying all across the country, and the enormous power of that, the connections that people are making and will know how to make, and by the time this is all over, everyone will be so good at Zoom. So that was I thought that was super. That was a super, since what we all want to be doing is making connections and organizing and getting stronger. I thought that was a really hopeful point. I was more on the like Zoom is too much Zoom school. So thanks.
Well, one other positive point that was mentioned was seeing how cooperative everybody's being in the COVID crisis, and how much people are, cooperating and doing it and caring about other people. That if that same approach could be taken with climate, it shows that people are capable of doing this. And could that be transferred to the future? I hope so.
All right, well, that's a nice way to segue maybe.
Yes, so thank you all. We're coming to our closing and also our final 16-minute video. I'd like to thank everybody who's still with us this afternoon. It's so fun to see new faces, and it's also really fun to see some familiar faces. So thanks everybody for joining us today. I'm going to turn over the final closing to Casey Loosbrock, and please do, for those of you who are interested and would like to learn more about the Coalition for Climate Safe Pensions, please do stay on for our 16-minute video. And Casey?
Yeah, while Vanessa's getting our slides up, let me just introduce myself. I'm Casey. I'm the Communications and Volunteer Manager for Fossil Free California. So you probably get emails from me a lot. But yeah, so after we close out here, we're gonna show a few videos. Our 16-minute intro video to the Climate Safe Pensions National Coalition. And we're gonna show an awesome divestment animation by Earth Guardians Bay Area Crew, which is the youth outfit that we work with closely on our Divest CalSTRS campaign.
And you don't want to miss it. It's really, really, really good.
So special.
And if people want to find out further information about Fossil Free California and ways to help, how can we go about doing that?
Yeah, so please follow us on social media. We are on all the places. And if you would like to help generate content for these channels or other communications, please join our volunteer communications team. Yeah, so we have tons of ways for people to volunteer. If you want to work on communications like social media and traditional media, if you're more of a campaign and organized-minded person, we work on divesting the 2 state pensions and moving personal portfolios out of climate, out of fossil fuel. We also work on tracking legislation, endorsing certain bills, and working closely with legislators. We do work year-round to keep this organization running. We fundraise, so if you have interest or experience there, we'd love your help. And if you have any admin or tech support experience, we'd love to have you on board. And the best way to do that is to go to fossilfreeca.org, casey@fossilfreeca.org/volunteer-form, or send me an email at any of the places, casey@fossilfreeca.org. Next slide, please.
Oh, sorry. That's all. Oh,
Yeah.
there you go.
And if you'd rather donate, then donate time. We love that. We do work year round, and we do need financial support year round. So we're doing high leverage work with a really small team. We're very effective and very efficient. So please do consider becoming a monthly donor with us. And that would be fossilfreeca.org/donate. Thank you so much. And we will be showing videos now for those who are interested.
Stand by.
I'm a senior in high school just outside of Rochester, New York, and I'm speaking to you while in quarantine. Dear New York State legislators, it is time to sponsor the Fossil Fuel Divestment Act.
Because it will save you lots and lots of money. The fossil fuel industry for the last decade has been a way to lose money. New York State has lost a lot already.
I'm a mother and a grandmother and a retiree in the state of New York. I'm a proud union member, and we don't want to see our hard-earned pension money go to investments in fossil fuels.
If New York State's plan is to reduce its dependence on fossil fuels, why is the retirement fund betting against us?
My name is Elena, and I'm a high school student in New York City. I'm currently in quarantine in my apartment in Brooklyn. I'm filming this to remind you that it is time to invest in a green future that all of us can live with. It is time for you to step up and be the climate leaders that we all need you to be.
It's time to stop financing the world's destruction by investing in the world's biggest polluters. It is time for us to stop risking our pensions by investing in a fossil fuel industry that has cost this pension fund billions of dollars.
My name is Clara Vondrich, and this is my pup Amethyst, or Amy. We're both taking a little break from quarantine here in Great Falls Park, Virginia, to announce a super exciting new push for a fossil-free world. Today, campaigners from around the United States and Canada are coming together behind a coalition for climate-safe pensions. Pension funds around the world control over $46 trillion in assets. That's a lot of money. And currently, because of old school investment practices, they're heavily invested in the fossil fuel industries that are burning a hole in the planet, and also in the pensions of hardworking Americans and Canadians. We know that the fossil fuel industry has been underperforming and volatile for over a decade, a losing bet for pensioners. We know that the big funds in New York State and California have already lost billions of dollars for their workers because of their investments in fossil fuels. This has got to stop. That's why youth and elders are uniting today behind the Coalition for Climate Safe Pensions.
I'm Lindsay, and I'm a rare millennial who's lucky enough to have a pension. I'm a member of the 6th largest pension fund in Canada, which manages over $100 billion in assets. I want to live in a world that is just and resilient to the shocks of climate change and other emergencies that are already coming our way. And yet my pension is investing my money in fossil fuel companies who are trampling on Indigenous rights and steering the world in the wrong direction. Not only that, but it's a terrible investment. Even the Bank of Canada is saying that investors need to take environmental factors into account. So why aren't my pension fund managers listening? Shift is empowering me and thousands of other Canadians to call on their pension funds to protect our pensions and invest in clean energy.
These very same companies that are conducting the fracking and oil and gas development here in our state, right next to schools and neighborhoods, are the same companies that public employees and teachers are investing in through their pensions. A lot of people don't know that an average pension fund in the United States invests 6 to 7% in fossil fuel companies. What gets me really excited about fossil fuel divestment work is the potential to reinvest our money in solutions and in where we want to be going for our future. So here in Colorado, the city of Denver divested its general funds from fossil fuels in 2019 And they immediately took that money and reinvested it in the local green and clean energy economy. We will continue to work on this, and we will continue to call on PARA to divest from fossil fuels. And we know that we're part of a growing movement.
We are 350 Austin. I personally got involved due to my work in commercial solar project financing and system design. We wrote a divestment report in 2017 tailored to the City of Austin employee retirement system, and they reciprocated with a 40% reduction in their fossil fuel holdings. In addition, we prepared a divestment white paper containing financial arguments tailored for investment boards for anyone to present. There is a collective awareness that has formed, and the respectful nature will only grow post this pandemic, and I'm excited to be continuing this work.
I had a chance this Earth Week to sit down with some of the leading campaigners in the space. Some of them are really young, ranging from 13 to 17, and others got a few more years under their belt. Here I'm going to share with you a few pieces of our conversation. I sat down with Anna Siegel from Maine. I sat down with Hridesh Singh from New York, Lynn Nittler from California, and Lolita Jackson from New York City. Take a listen and stay tuned. We'll have some tips on how to get involved at the end of the segment. Thank you. Having the youth energy injected into this moment at this time couldn't be more important. So I'm really grateful to Hridesh and Anna for being here. And I'd like to just start with you two. Why, as young climate leaders, are you concerned about pensions?
Well, actually, surprisingly, the divestment campaign that I've been working on with my peers to divest from New York has been perhaps the most engaging and inspiring campaign I've actually been a part of.
Me, I am very legislatively focused and very electorally focused. I'm always thinking, what bills can we pass? What can we get done? What can we push forward? And how can we get that signed off? But with divestment, I've been realizing that fighting fracking and making solar deals and passing Green New Deal bills doesn't make a substantial shift. The coal and oil industry still has its current lobbying powers with our politicians. We cannot take on the political legislative system without first taking on the financial system.
Thanks so much. Great to have you here. Lolita Jackson, Special Advisor to New York City on Climate.
And I am the co-lead, or we are the co-lead with the City of London of the C4K Divest Invest Forum, which contains 14 cities around the world, where we walk them through different ways of thinking about divestment and investing in climate solutions. And I'm also personally interested in the topic because I'm actually a member of NYSERD, which is the New York City Employee Retirement Fund. And I look young, but I'm actually 53. So I will be collecting in only 10 short years.
So I'd like to pivot now to Lynn, who's actually a pensioner with the California State Teachers Retirement Board.
Fossil Free California is active. We have two big pension plans in Sacramento. I'm very near to Sacramento. So we have the public employees one, slightly larger, and the CalSTRS one, which is very big too.
I've been very inspired by this campaign, and the fact that we're really close to the finish line here in New York State is very, very motivating and very energizing.
Thank you so much. And now while we're on that point of being almost across the finish line in New York State, we have to recognize here that we did cross the finish line with New York City, another very significant pool of capital. At the time, it was around almost $200 billion, and maybe a little bit less since the recent stock market crash. But I'd like to turn it to Lolita and ask, how did you guys bring this about? Why did your mayor and why did you, as one of the key architects of the decision, decide this was a priority? And how did you respond to skeptics, especially financial experts, the very serious guys in the room that said divestment is risky, divestment is actually going to impact and undercut our fiduciary duty to protect long-term wealth for our pensioners? What were some of the obstacles you faced and how did you come around and win?
Well, the easiest thing to do really is to show the fiscal case for why investing in fossil fuels just didn't make sense from a financial standpoint. So an institution called Mercer did a study for our pension board, and they found that it just was not sensible to continue to invest in this as an asset. And some of our trustees, in particular from the labor movement, were really moved by that. And also the opportunity to be involved in sustainable investments and sustainable solutions is also something that weighed significantly for New York City. So we actually had those two decisions not too far apart to not only get out of fossil fuels, but start investing in a sustainable future that includes a just transition in it. We have a toolkit that we've come out with that was released in January of this year that's available to anyone listening here. It really walks cities through a checklist of things that you have to think about, working with advocates, and Clara, you and I have worked together directly on this work. How to politically get the decision made. If you don't control your city's pension or your state's pension, how you can use tools and techniques to actually persuade those folks to do that. So it really walks you through as a city person the steps that you need to take and think about when you're trying to make this decision.
How do you think Comptroller Tom DiNapoli, the sole trustee of the New York State Pension Fund, could help support a Green New Deal for New York State?
Public pensions are a huge asset pool throughout the world. New York State Common Retirement Fund alone has about $210 billion worth of assets, with about $12 billion invested in the fossil fuel industry. By using those assets to invest in clean energy infrastructure and clean, green, high-paying jobs right here in New York State, it's not only a boon for pensioners and our future, but a boon for the local New York State economy, which is why I'm pretty hopeful that as we divest away from the fossil fuel industry, we can reinvest and use those same assets to invest in a clean energy economy that works for us all.
Look at the fact now that the price of oil is below $30 a barrel, and it's just going to keep going down. So I think, unfortunately, in this time of COVID, the case makes itself. If you stay in fossil fuels, that demand's not coming back.
I am really just, struck emotionally by this idea that so many workers are struggling right now. And the last thing they need to worry about in the midst of this crisis is their nest eggs blowing up in smoke.
If the Common Retirement Fund divested about a decade earlier, it would be about $22.2 billion richer than it is today. And this was before the coronavirus crash. So, and that total accounts for about $20,000 per pensioner. So this issue that we're advocating for, rather advocating against, it has a labor component, it has a youth component, there's a fiduciary duty component, it's a financial duty component, and it helps to create a clean energy economy that works for us all. So by advocating for divestment, you're advocating to a vast swath of different interest groups, which is why the divestment movement has been growing rapidly each and every year since the first divestment campaign back in Swarthmore back in 2010.
I want to shift now to a really important question that I think state pension and city pension campaigns have to grapple with. And this is generating support by pensioners themselves, most of whom are union members.
And to bring together elders and youth and put both of our commitments together and then work forward from there is very powerful. So I think this is a turning point moment.
My name is Melissa Wenzel, and I'm a Sustainability Administrator for the state of Minnesota. I'm also a local union steward and a volunteer with 350 Minnesota. I've led initiatives to support divestment research and got involved with this because I take the topic of climate change seriously, and I know that these investments are risky and volatile. I look forward to the day where we can say that our pensions are free from fossil fuel investments. What's awesome is that not only are more of our union members aware of this topic, they support it. The support is more common than you think.
Hi, I'm Bob Schroeder with 350 Juneau in Juneau, Alaska. Behind me is the Mendenhall Glacier, which has been retreating really rapidly, and it's part of why I'm involved in climate change. Our divestment campaign focuses on the Alaska Permanent Fund and the Retirement Benefit Board, which together manage $100 billion in state funds that belong to the workers of Alaska. What our campaign does is to raise the question of whether you make any money by investing in oil stocks and fossil fuel industries, and we hope to shut this down.
We are the Divest New Jersey Coalition, which is led by 350 NJ Rockland. We started our campaign in September 2018 to persuade the New Jersey State Investment Council, who oversees the New Jersey public pension, to divest from fossil fuels. We protest, we sing, we chant, and testify at every single one of the council's bi-monthly meetings in Trenton. We are also gaining momentum, extending our campaign into the labor movement.
We need to build a better future.
and we need to start right now.
Miranda Yuntas, What's to Live by Gang. Hi, I'm Miranda, a coordinator at Shift Action for Pension Wealth and Planet Health in Toronto, or Toronto, Canada. At Shift, we believe that it's time for pension funds to invest in climate solutions now. The real power of our work comes from working with pension holders themselves.
Hi, my name is Kim Fry, and I'm an elementary school teacher in Toronto, Ontario, Canada. I care about my students, and I care about my own children. I want them to have a bright future, and that is why I have worked with other teachers for many years to call on the Ontario Teachers Pension Plan, my pension plan, to divest its holdings from fossil fuels.
Hi, my name is Natasha. I'm an Ontario teacher. I'm failing my students if I cannot prepare them for the world that they will inherit. And they are the real reason that I wish to push my pension plan to divest from fossil fuels.
Did you know that your teachers have $6 billion invested in fossil fuels, and most of them don't even know it? So this fall, your teacher has homework. They need to watch this video and then go tell CalSTRS to divest their pension from fossil fuels.
CalSTRS is investing our pensions in fossil fuels and losing us money.
And wrecking the future for our students.
And for us.
CalSTRS needs to divest from fossil fuels for financial as well as moral reasons.
CTA needs to change its position and support CalSTRS divestment.
Hi, I'm Vanessa Warheit with Fossil Free California. We're a proud member of the North American Coalition of Climate Safe Pension Campaigns. Please join us and let's move our money out of fossil fuels and into a just green recovery. Visit climatesafepensions.org to sign the petition and learn how you can get involved in a campaign near you. And join us tonight, 7 p.m. Eastern, 4 p.m. Pacific. We're going to have a live discussion with Clara and some special guests who can answer all of your questions. Thank you.
All right, and here, for all you amazing folks who have waited, is the Divest Kids video. Here we go.
We are the Earth Guardian's favorite crew and Youth First Apocalypse. We're a group of young activists helping to save our future from the climate emergency.
We saw how fast everyday people around the world can work together when the scientists told us about the dangers of the coronavirus.
We know we have the same power to work together to make a just and healthy future for all.
Mother Nature, Indigenous leaders, frontline communities, and climate scientists have been screaming out that we need to leave oil in the ground.
Adults in powerful positions have not been listening. Instead, they're investing a ton of money in the fossil fuel industry.
As long as these companies keep getting money, they're going to use it to keep looking for oil so they can drill for it.
Even during this pandemic, while people don't even have enough money to feed their families, and hospitals don't have the equipment they need, governments are still giving fossil fuel companies big money along with permission to frack and drill for more oil.
We've learned about a super important action that can stop this. It's called divestment. So what is divestment? It's when a person or organization takes money out of certain types of banks, companies, and funds. Divestment can take power away from the industries that are causing really big harm. Divestment frees up money to be invested in solutions, like green jobs.
Now be careful. Some adults say that by investing in these companies, we will own a portion of them and have a say that can get them to change their ways. It's called the engagement strategy.
Engagement only works when you're trying to make smaller changes within a company, not when you need to change everything about that company. We have to stop them.
Now you might wonder how we kids learned about divestment and all this money stuff. In California, we found out that most of our teachers have no idea that more than $6 billion of their retirement money is being invested in fossil fuel companies right now.
The organization that decides where to invest our teachers' money is called CalSTRS. Once we found out, we decided to miss school so we could go to every one of their board meetings until they divest. Youth and teachers fill up the boardroom and give powerful testimony, but they censor the youth and say that we are too young to be included in their public record.
We keep trying to talk with them, but they say they want to engage with the fossil fuel companies. Those board members don't have to live with the consequences like we will. So we have been staging different disruptions to let them know that they must divest. We did a die-in just outside their headquarters. We danced in the middle of their meeting. We got media attention by covering ourselves in fake oil. But still, they say no to divesting.
It's extremely weird because over the last 10 years, fossil fuel companies have actually been losing money. Our teachers would have been making more money if CalSTRS wasn't invested in instruction. So we got more students to tell their teachers. When those teachers find out, they are really upset and join us in demanding CalSTRS divest.
As the world turns to renewable sources, fossil fuel investments are going to be worth less and less. But the fossil fuel companies are really good at pretending like they will be part of the solution, even though they're screwing everything up. This is called greenwashing.
Like when a fossil fuel company says they are working really hard on creating sustainable energy solutions, like developing more wind turbines and solar panels, even if only 1% of their money is being used to do it.
Also, lots of other adults don't know that their money is supporting fossil fuels too. And places like banks, universities, entire cities, places of worship, the list goes on and on. We need your help letting them know.
This wasn't what we wanted to do with our childhood, but the grown-ups have given us no choice. Together we can do this. Will you join us?
Start by asking adults in your life if they know if their investments and banks are fossil free. Visit our website to learn how you can demand divestment and get people around you organized.
We're here to help each other.
Thanks so much, Vanessa, for having the videos tonight. So thank you, everybody who's still on the call. We really appreciate your participating. We're going to have our May call at the last Tuesday of May, and it will be focusing on inclusion and equity, and probably a little bit about the green recovery also, is my hunch. So thank you again so much tonight, and we all wish you good health and safety, and for you and your loved ones at this time.
Thank you, Martha. Thank you so much.
Thanks, everybody.
Bye. Hi, Deb.
Thank you, everyone.
Bye. Hi, Christine.
Bye.
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 Thanks a lot.